for staying with us as we learn more about coronavirus and today's children and about the experiences that everyone might have. But what about the experience as a parent? How would you feel if your child may have been the one who's experiencing the symptoms? Let's talk to Dr. Govan and hear her experience. Dr. Govan, tell us about your experience being a parent.
Thank you for having me on today. My name is Wanda GOVAN Jenkins. I'm not a medical doctor. I have a doctorate degree in nursing. I've been in nursing for over 28 years now, and I am been working for the last 10 years, 12 years in informatics. That's my background. But I'm not going to talk about that part today. I'm talking on a basis of a parent because my 11-year-old son was diagnosed with MSIC, what Dr. Karen and Dr. J just recently talked about. A family member had taken my son into the Walmart. That's the only place that we can think that he had was exposed to the COVID-19 because I had not taken. Everybody who knows me know that I am very like a germaphobe, to be put it. I don't take my kids since March. I have not taken them to any stores because we know kids can touch things. So, but a family member did take him into the Walmart, and he came back home on that was on Saturday. He came back home on Tuesday morning, and he started complaining, "Mommy, my stomach hurt, and I don't feel well." So I was like, okay, you may just picked up a bug or something, where you were. So the next day he started getting fever, and he kept saying, "Mommy, my stomach is hurting." And I was like, okay, it's got to run its course. It's probably a stomach virus. The fever kept coming, but not high, maybe like 100.5 or something like that. And then a few days later, on Friday, the fever went away. So I said, okay, that's a virus. It just ran its course. And but he kept on saying, "Mommy, my stomach hurt." And he wasn't eating. He wasn't himself. And that continued for that entire weekend. And I just figured, I just said, let me just watch it, by me and the mom and the nurse was like, let me just watch it, we'll see what happens. But I noticed that his energy level was down. He wasn't himself. And then by Tuesday, the fever came back, and it came back higher. The pain was getting worse in his stomach, and I'm like, what is going on? So I was like, maybe I didn't clean his room good enough when he was sick with the stomach virus from last week. Let me go back in and clean his room again, because, sometimes that can happen when you reinfect yourself. So I said, let me just clean his room really good. And so the fever was just around the clock. Every 4 hours, that temperature was getting up to 102. And the stomach pain was getting worse. He hadn't been eating. And so, of course, I started getting concerned because my son, I have an 11-year-old son and a 12-year-old daughter. My daughter is the one who has asthma, and so do I. And that's why I was really concerned since March that, neither one of us would get exposed to coronavirus because of our asthma. And so my son never gets sick. If he gets sick, 24 hours later, he knocks whatever he had in. So that was concerning when the temperature lasted and the stomach pain lasted. It was concerning, but I was like not too concerned just yet. But when it came back, when the fever came back on that Tuesday and lasted around the clock, finally I said, you know what, let me take him to see the doctor. So called the doctor on Wednesday, got in on Thursday. And, I was listening to Dr. J. He was saying how, you just probably don't believe that the child has the virus. But I told my doctor, I said, I want him to be tested. and he said, "Oh, I don't think he has, the coronavirus." I said, "But still," I said, "Can we test him for strep? Can we test him for the flu? I want all of that to be checked." And so he did. He didn't give me any pushback. The flu came back negative right in the office. The strep came back negative in the office, but the coronavirus, COVID-19 test was not going to be resulted until that was Thursday, probably on the weekend, sometime Saturday, Sunday, or Monday. So, but he did take his blood count, his CBC, which tested his white blood count. So the white blood count was really, really low. But he said, "Oh, the white blood count is always low. My white blood count is low." And but that is definitely, but he was like, "I'm not concerned about that." But of course, the blood count would show, the white blood count, if it's really low, it shows that that patient has a viral infection. It's not bacterial. So so I was just thinking about that, as we went home. I'm like, okay, he definitely has something viral, but what is it? And so we went home. Fever was just, it was just bad. It was around the clock, and every time he got a fever, he would cry out, "Mommy, I don't feel well." And he was scared. He said, "Mommy, I don't want to have the coronavirus." I just had to, be mommy. I said, "Mom, don't worry about it. If you got corona, mommy got corona. Don't worry about it. Mommy gonna get you better." And so the next day he was crying because the pain was so bad, it wasn't eating. I said, "Let me take my baby to the emergency room, because I can't wait until this test gets resulted. Sunday, Monday. Let me find out now what's going on." So took him to the ER, and I told them what I thought was going on. I didn't know, but he was tested at the doctor's office yesterday, and what have you. So the doctor came in the room and said, "Yeah, we need to definitely figure out what is going on. I don't think we need to do another test right now, another COVID test right now, but let me just take a lot of blood work and see what's going on." So about 2 in the morning, he came in the room, and I get kind of emotional with this because I'm alone. Only one parent could be there. My son was asleep, and he was like, "This is what we think is going on, and we don't know a whole lot about it. But, we think your son has MISC. And that's when, he started explaining it more to me. And I had kind of read up on it, but I didn't know much about it. And he was like, his organs are inflamed. We see that his intestines are inflamed. Kidneys are inflamed. All of his labs, when he showed it to me at 2 in the morning, all of his labs were red. They were like just red. The whole page was red. And that was like very frightening for me. Like, oh my God. And they were like, "We're going to go ahead and keep him to figure out what's going on. To figure out, how can we, treat it." And we may have to call John Hopkins to get, some, just call John Hopkins to get, referral, talk to them about what else they should be doing. And
welcome back to Systematic Speaks. And we want to thank Dr. Wanda. We're going to refer to her as the parent of the year of the century, Dr. Wanda, for her story and her testimony about her faith and how it brought her through. Let's now go back to getting some more medical information from the doctors about COVID and some things we should be looking for. Loyalty, take us in.
So, Dr. Hargett, well, actually, I think both of the doctors may want to answer this. What would be the best way to talk to your children about COVID-19?
Good question. Another frequent question. So the first thing I would say is to be honest. Children do feed off of your energy. So another thing another thing to keep in mind is that it needs to be age appropriate. They do have a lot of things on like YouTube or videos that are kid friendly, but I want you to review it first before you show your child to see if it's suitable for your particular child. But be honest about what it is. Try not to have too much nervous energy involved when you're talking to them, because there are a lot of things going on in life right now. Coronavirus is an unprecedented illness that we're dealing with in our society, but there are other things going on also, and the children feel the stress and the tension that you feed to them. So it's just like if you were to speak to any other crowd or anyone else, you want to be as calm and exude as much calmness as possible. Be truthful and let them know that there are things that can be done, that they can protect themselves, and that is not just a complete, or give them some assurance that it's not a complete, we're just out there against this big virus that it's only a matter of time before it's doomsday, just try to reassure them. But there is an uptick, a significant uptick in children that are seeking medical attention, and not necessarily because of coronavirus or a cold or anything, but it's more mental health and psychologically related things that's going on. And you have to understand that their whole structure has been changed also, just being out of school, or their norm, not being able to interact with their peers. So everything has changed. And for children, that is a major traumatic event. Any change, even changing formula for babies, is a major event for them. So just have to keep that in mind. And when you are having a plan with them, I think it's good to try to state a plan for your family, to give them some expectation of how we're going to come out of this, or when outside opens, this is how we're going to proceed, and maybe try to let them know that there may be a new normal, which I think there is going to be a new normal for our society, because it doesn't look like we're going to be able to get rid of COVID-19, SARS-CoV out of our ecosystem because of the differing views of people in their rights and political views. Dr. J.
Yeah, so actually, mental health is a really big thing that we need to discuss, not even with kids, but with adults. So mental health is going to be a big thing. I was on another coronavirus call that my fraternity sponsors once a week. And the one thing one of the speakers said is true. When you said the new normal, it's no longer the new normal. It's just normal. So there's not new normal. It's just the new way. It's the normal way of doing things now. And so that's kind of, I think, the approach we need to talk to our kids. So the normal now, the normal things that we're going to do is we're not going to be bunched up like we are, or we're not going to, we're going to wear these masks whenever we go out. The normal is going to be, even as here in Tennessee, when they open up and when you go to school, you may actually not go to school with your peers. The normal was, and I don't know how it is in PG County, but the normal was we did have graduations down here, but it was outside and you were spaced 6 feet apart. So that's the normal, and that's what you need to talk to your kids about.
Well, we didn't have graduation, so everybody here just had to put your cap and gown on, and they had front yards and signs, and people rode by because there were no official graduations. So it is, you're right, no more the new normal. It's going to be what is normal now.
Right, and then even here, and like I said, I don't want to get into the politics of it, but some of the counties down here even had prom. And went ahead and had those things. And at the mental health of things, you just have to kind of realize it's the normal way of doing things now. And if you kind of have that approach to it, I think it's best for you and your kids and your family.
And I'm glad you mentioned about mental health, because we just did a show in mental health in today's society with Dr. Dwayne, who is one of our great doctors, who talked to us about different signs of seeing when you need to talk to someone, things you need to be cognizant of. He talked about your daily activities of life and how we don't even realize that because of Corona, the things that we normally do daily, like, for me, it's been emotional eating, because the refrigerator is there, there's nothing else to do and I can't go outside. So that's why I look so fat on camera. It's not how I really look. I'm really thin in real life. All you all know. But it's the new normal, things that I really didn't take into consideration that I was doing because of not only Corona, but being confined to the house, the protests, all the things, and I will tell you, it's different in how you talk to your children, because for me, having a 24-year-old and a 21-year-old, my conversation has been doom or gloom. You go outside, you get Corona, you're going to die, because I'm afraid that they're going to bring it back. I'm more concerned that not about them, it's if I'm going to die. I'm more concerned about me. You'll make it fine. You're healthy, you're young, you'll be the ones who skate right through, and you're looking for my life insurance policy. So I'm trying to make sure that I'm able to spend my money on me and not have to spend it on them. So it is a different conversation.
And much like Kim, I have 2 teenagers. And my teenagers, they want to come right in the house and hit the refrigerator. No one wants to wash hands. And I'm like, you have to wash your hands. And then, again, with me having illnesses and then my husband, and then my mom, who is in a nursing facility. So I want to make sure that we're all healthy so that when the facilities open back up, we're able to see her. So.
Yeah, I got one of my patients just recently had a baby, and her question is, how do I protect, my child, because her father's church, which is the grandfather of the baby, they started going back to church, and they just think this Corona is overblown. So they started going back to church. He's a greeter at the church. And then he also works in a facility that's high risk for catching coronavirus. So her question is, when could my dad come see my infant? And I didn't want to, I just told her straight, I wouldn't have him come see my infant. Because he's not practicing the things. He doesn't wear a mask. He's a greeter to church. And, he works at this facility where, he works basically in a prison. And by working in the prison, he's exposed to coronavirus because of where he works. So, that's a big thing. I always tell my parents, it's not about the kids kind of really, even though I know, Dr. Wanda had an issue with her kid. It's the kids that get it, they're asymptomatic or not as bad, but then they take it home to the grandparents and the great-grandparents. Those ones, that's the scary part.
Absolutely. So we have to all look out for our own safety, as well as make sure that our kids, who, are the ones that probably are going to be just fine, they have the immune systems and don't have the underlying issues, that you have normally a lot of times that you get with being older and the bad habits, and then the social economics and all the other things we could talk about, which is just a whole nother show that we'll have to have. But just making sure that we do the right things. So Dr. Hargett, I have another question for you. And I'm going back and forth, Dr. Karen. But what precautionary measures can be taken to protect the children from getting coronavirus?
So we pretty much covered a lot. So just to put it all in one lump sum, just the same thing that adults are expected to do. Keep social distancing, at least 6 feet apart. Wear a mask if the children are over 2 years old, unless you have established breathing issues and can't wear the mask. Wash hands. Oh, that should have been number one. Wash your hands for 20 seconds with soap and water, preferably. If there's no soap and water around that you can get the friction, use hand sanitizer with at least 60% based alcohol. So wash your hands, keeping distance, wearing your mask when you're out. For younger children, of course, trying to clean those fomite areas that Dr. J was talking about earlier, those inanimate objects, their toys. It's difficult to get to stuffed animals or what have you, but you're trying to keep their child's environment wherever they go as I don't want to say sterile, but as clean as possible, because any second this can be clear, and then you get a visitor and then it's not clear anymore. So you just want to be very cognizant of that. And I wanted to add that I feel like it's we're gambling. It's a game of risk. Basically, we don't know what coronavirus is, how we're going to get it under control. But as far as the decisions you make for yourself and your family, you have to weigh the risks. That's as far as when they say things open up, or as far as you letting them go back to church or go to the daycare, or even playing with other children on the block. It's a risk that you take if you allow that to happen. If you don't know every single place that your neighbors have been, or if you know that they've been in the house and you've been in the house and nobody's been sick and it's been 2 weeks, it's safe to, I would say it's safe to take the risk to let them play together, maybe in your backyard if you have one, or just in a isolated space. But the choice is, you're going to live in a bubble, or you're going to take precautions indefinitely, I should say, or you're going to take the risk every time you decide to extend a little bit further.
So Dr. Johnson, summer's here, which means that summer camps are trying to take some precautionary measures. You have some summer sports that are taking place. I know my son plays football, and he normally does workouts in the summer. So what do you suggest for kids? What do you suggest my kids do as far as summer activities or youth sports?
Yeah, so down here in Murfreesboro, I follow the CDC's recommendations. But at the Boys and Girls Club, where I'm on the board of, we actually opened up on June 1st. We had 100 kids, and they were kids of essential workers. And so what we practice is we practice just what the CDC says. So we check temperatures. We ask specific questions of the kids that are coming in. We also check the temperatures of our workers, and we make sure our workers aren't going into any hot spots. They wear masks, and they all go to a station. The stations are 6 feet apart. And so they actually have tablets and activities to do. When it's time to go outside, they put their mask back on, because they can take their masks off when they're at the station. And they put their mask back on, and they go outside. And our Boys and Girls Club staff have actually come up with a ton of games where you really don't have to be interactive. You can still be 6 feet apart. But to your question, as far as summer activities, so we know that this virus cannot survive in chlorine. So, can I go to the pool? Well, the thing is getting from your car and getting from the locker to the pool area. That's something that's going to be at risk. As far as AAU basketball and as far as football training and all those, we've actually started football, because we start school here earlier than you all do by about a month. So we've already started football practices. In school, we had 10 kids that came up positive for coronavirus. At another school, we had a coach that came up positive for coronavirus. So the risk factors, you have to understand the risk factors when it comes to AAU, travel baseball, football, anything. You're the lowest at risk if you're practicing at home by yourself. The next risk, or the next step of severity, is if you're practicing with people of the same area where you're from. So let's say in the same little area in Murfreesboro. The next step, or the next risk, is if you're actually playing games and actively participating and doing scrimmages and those things of people in that area. The highest risk is if you're participating in sports and people not from your region. So I'll give you an example. Like I'll talk to my fraternity. We had a call about 2 weeks ago, and let's imagine that your AAU basketball team is playing against a team out of New York City. Your risk is going to go up 100 times playing against those kids from New York City than playing from the kids here. So yes, summer is opening up. As long as we're practicing social distancing and practicing the normal, not the new normal, but the normal way of doing things now, I think you'll be fine. And we got to let kids be kids. Like, I was one of the ones that actually advised the Murfreesboro City School as well as Rutherford, the Boys and Girls Club, to shut down when we did. But, it's getting to the point now we understand a little bit more of it now that we got to let kids be kids. But you got to be precautious when you open back up.
And that's a good question because, we see that in a lot of the colleges now that they're starting to practice and a lot of the kids are coming down with it, and so as a parent, my first thing, my son played football, is that I would touch my child up. He can't be around all those people and traveling around, going to other schools. That would make me nervous. And, the biggest thing for me is restrooms, going into public restrooms and touching all those germy things. I would just be nervous. So I understand about social distancing, about washing our hands, but what about the facilities? Like, are there really things to make sure that they're clean and that they're killing the coronavirus coming behind people that may have it, so that we're going to make sure that, kids, as they start these sports and things, that they're able to be safe. So you all have started it already. And I get all the things you're doing from a medical perspective, but what about the other factors that you don't really, have control over?
Yeah, I think it's up to each facility and school to make sure that the area is clean. Someone who played football and basketball, though, you know how locker room is, and you know how hard it's going to be. And we all got we had teenage kids, and are they really doing what they're supposed to do? Probably not. So, you have to think of all those risk factors, and so you're right. The facilities are going to be the tricky thing on trying to keep those areas in locker rooms, weight rooms, all those different things clean. And I mean, I just saw a tweet from the University of Maryland College Park. They spread out their weight room, but, the weights and those things. But if they're not constantly cleaning those things, you're just taking a risk of spreading it.
Absolutely.
So, Dr. Hargett, I'm sorry, I have a question prior to us moving forward. Does us being quarantined, how does that impact our immune system in terms of, are we suppressing our immune system and not it's not built up or as strong to allow us to be able to fight off other things that that we may have been able to fight off previously?
That's a very good question. So I believe not. So I know what you're saying. Like, if we need to have exposure, like kids need exposure to daycare so they can build up those immune memory cells.
Correct.
I go back to it's a risk. It's the risk you take, and we want to mitigate those risks as far as COVID-19 is concerned. Like, what is our top priority to figure out what we're going to do until this virus is either under control, or we have a more efficient use of testing, or it leaves our ecosystem, which is preferable, but it's not going to leave our ecosystem if we keep exposing ourselves. And being that we don't have any restrictions on the United States as far as traveling, it could easily, like the places that are rising now, it could easily be back in New York next week. I know everyone is trying to do what they can do to lessen the chance of it sparking up again. But being that we have no restriction on where we go as a free society, that's really hard, and people feel a certain type of way about their rights. But in an ideal situation for me, I would have tried to lock everything down. Once Wall Street closed and I knew that this was real, I would have tried to be like 2 to 4 weeks, everybody on lockdown, because we ended up being on lockdown once we realized that this thing is no joke, and as we're learning more about it. But I thought if we could lock down for 4 weeks and nobody could contact anybody else, then we'd be good. But that, of course, is a fairy tale situation for me.
Thank you.
Absolutely. And we can't live in a fairy tale world.
Right.
So I have a question for both of you all, both of the doctors. So with school coming up in the fall, is it safe to send your kids back to school? And is it safe for them, especially for the elementary school children, to go outside and play?
Yeah, well, you want to take that first, Karen, or me?
No, I want you to take it first.
Okay. All right. So basically, I've actually joke around with all my patients, and I'm telling them they better have good internet service unlike you, Kim. And you also need to have a good laptop, because we're not staying in school the whole year. It just ain't gonna happen. It's not. So basically, all it takes, and give you a scenario. First of all, your question, is it safe to send your kids back? It's safe as long as they're practicing what the CDC recommends, not what your current politician recommends, not what your grandma recommends, but what the CDC recommends. And so if you do, it's going to be safe. However, this is what's going to happen in the scenario. So you got 30 kids in a classroom, and somebody who doesn't believe or doesn't really care about it or whatever, doesn't follow the precautions. Yes, they take the temperature. The temperature is normal because, once again, 25% are asymptomatic. So then, let's say, for instance, for one reason or another, they get tested and they're positive. Everybody in that classroom, we just said the infectivity rate is half, right? So out of them 30 kids, 15 of them are going to have coronavirus. They're going to have to shut down and do contact tracing to find out who those people had. So where was that kid? Oh, he was in the hallway. They were hall monitored. Oh, plus besides the way, they were in ROTC. Oh, by the way, they were on the football team. So, once they do that, they're going to have to shut the schools down for, I don't know how long or whatever, but they're going to have to shut the schools down. So I'm telling a lot of parents, it's going to be a lot of homeschooling.
Homeschooling.
Right. So we actually, here in Murfreesboro, we asked the parents 3 things. You want to go back to regular school? You want to split up the school kids into 2, and some go one day, some go the other day, or you want to do all virtual learning? And the majority of them surprisingly voted just to go back to school. So that's what we'll be doing down here. Now, the University of Tennessee and all the other Tennessee schools will follow suit. They're going to start college early, and they're going to end college on Thanksgiving. So you're done in Thanksgiving because we're expecting that second wave to come. And that's what I'm telling parents too. Get in as much as you can while you can in August and September, because come October, November, we might have no school again.
Wow. So to both of the doctors, what are your current recommendations for daycares and churches?
But wait a minute, 1 second, Royalty. I want to give Dr. Karen a chance to answer that same question.
Oh, I'm so sorry. I thought she did.
No, I thought I did too. Repeat the question for me.
So the question was about kids going back to school in the fall. Is it safe, and can they go outside and play?
Oh, right. So
yeah, you opted to make Dr. J go first.
Oh, that's right. So yeah, my strong opinion about that is no, it's not safe. I mean, I just have a strong no answer for that. Irrespective of the thoughts and concerns about, children need to socialize and all this. I just don't think it's going to be safe. And I think we're going to have a scenario just like Dr. J said. And as far as going outside, like I was alluding to before, if you can get a good take on your environment or keeping it within your community and you pretty much know very well, I mean, the kids can go outside, or depends on what area you live in. If you live in a condensed urban population, I mean, you have to be careful about that, but you know your environment, you know your child, and you know your neighbors. So just have to exercise good judgment and weigh your pros and cons and reassess every day or every time. Just keep reassessing whether you think the situation is safe or their risk is increased for whatever reason. And follow the CDC or your local guidelines, because they have the rates of infection in your city, town, or your surrounding areas.
And you're absolutely right. My son is at University of Maryland Eastern Shore, and they decided they normally go back to school after Labor Day. They're starting school August the 12th, and they're ending at Thanksgiving break. But they're also decided they're going to end because they know that people are going to travel for Thanksgiving, and they're going to travel into highly areas that have high risk of coronavirus, and they're going to be around family, etc., and not going to be as safe. And so they don't want to bring it back where kids won't quarantine because they have to go to class. So they made the decision of, okay, they're not going to come back until the next semester, being in January, also understanding that there's going to be a second wave. But we hear our politicians say there is no second wave. So, you know, you have to weigh out whether you're going to listen to politics or whether you're going to listen to science and whether you're going to listen to medical advice.
But basically, they really don't know. And so, you know, most of these decisions are based on economic reasons. And as far as letting kids out on Thanksgiving, if they make it through to Thanksgiving, we'll find out our answer by Christmas. You know,
exactly.
4 weeks after all the visiting and stuff, and then they may have to reassess and not open schools back up in January. It really is an unknown, and I feel like it's experimental, and I understand that our economy needs to get going and institutions need to go forth, but we're not going to accomplish what we need to accomplish with a half-butt method of doing things.
Exactly.
I'll just put out a PSA to my family members watching. I won't be coming to see you on Thanksgiving.
How about we can all have a Zoom meeting? How about that?
Right.
We did. We had a Zoom Mother's Day. My family, we're real tight. We had a Zoom Mother's Day.
Yep.
But that's
Dr. J, my internet will be working. Well, T, take us into the next question.
So yeah, I understand about the Zoom parties, because we did a Zoom birthday party for my grandmother who turned 95, and that was in March. So it's working. So we'll just keep it like that. So to both of the doctors, what are your current recommendations for the daycares and the churches? Dr. Johnson, I'll start with you.
Well, the current recommendations for daycares and churches are the same exact thing as CDC, except I throw a little twist in it. So basically, you know, you need to check temperatures as the kids come in. You need the parents to stay in the car. You need to grab the kid, bring them back in, and you need to try to keep them separated as much as possible. Any kid over 2 should be wearing a mask. I actually had a picture of one of my little 18-month-old patients with a mask, and even though we don't recommend it, she was happy to have her mask on. But so those are recommendations. However, this is the thing that we need to concentrate on. I'm not worried about the daycare. I'm worried about their workers. All it takes is one worker to say, I'm going to a protest, or I'm going to New York City, or I don't believe in coronavirus because my politician said that he had it taken care of. So we're going to actually not listen to any of that. And now I'm going to expose myself to all this, and then I'm going to bring myself to work, you know, or for economic reasons, I feel sick, but I'm still coming into work because I need a check. And that's how it kind of spreads. But those are the things we need to do with daycare workers, is the owners need to make sure that they check their workers. And besides that, we need to clean as much as possible in between that. Now, as far as churches, that's another thing. I'm part of one of the largest African-American churches here in Murfreesboro, and we haven't opened yet. And the reason why is we can't open safely for our parishioners. And that's the kind of adage we're taking is that you have to clean beforehand. Then you have to come up with an emergency preparedness situation if somebody gets completely ill. You have to supply the churchgoers masks and gloves if they forgot to bring them. Mm-hmm. You have to ask them specific questions where they've been if they feel ill. You have to check their temperatures for every churchgoer that comes in there. And then they have to stay separated. They have to be 6 feet apart. And our church is pretty big, and we got 3 services, and it's just hard to do. So maybe at some of the smaller churches, that's fine. But at the bigger churches, that's just kind of impossible. Plus, we had 3 services, so we would have to clean in between the different services, just to prevent that. And then the last thing is that I brought up, because I'm on the Corona team for my church, is do we put the older people in the very back so when people are coughing, they're coughing this way and not coughing backwards? Because the older people, the 70 and 80-year-olds, are the ones that are at risk. Or do we even let people 70 and 80-year-olds come to church anymore? Like, will they be banned from church? And then also another question is, what about the daycare we have at church? What do you do about that? So it's just a lot of different factors when it comes to church and daycare.
Yeah, it's a lot to think about, and making sure you keep people safe, and when we've talked about coughing, but think about sneezing. I mean, that goes everywhere. It's not just in the front, it's kind of up in there and it goes everywhere. So, and you can't ban my grandma from church. My grandma is not gonna have it. If she
Or
can't,
put her in the back.
none of us come to church. Okay, that is not the new norm. Grandma could not be banned from church. So we have to start thinking about things differently. Let's go to break, and we'll think about how we do things differently in coronavirus today. Come back as we complete our conversation with Dr. J and Dr. Karen on coronavirus and children. Royalty, take us to our last segment.
Sure. Dr. Hargett, what kind of masks are best for children and parents? And are filters recommended? If so, what kind of filters?
So the kind of masks that are recommended are made out of basically cotton material, tightly woven material, and they suggest that there be at least, well, at first it was 2 layers, but I think I heard recently it was 3 layers. Dr. J can confirm or deny that for me, but so 2 layers of material, and that prevents the likelihood of the virus particle getting through, the holes or whatever opening in that first layer. So, and I think they added the 3rd layer, and I think the filter can count as a 3rd layer. So I'm plus or minus with the filter. I don't really think, or I don't know if it's necessary, but I don't think it's harmful if you have a pure filter. So some people are getting filters from other sources that may be harmful. Like if they get if they have vacuum cleaner filter, but know what the filter is made out of, know if it has carbon in it. So you don't want to be consistently breathing in other things that might be detrimental to your health. But just as far as children and adults, having a tightly woven material, preferably cotton, 2 to 3 layers, and children over 2 years old.
Yeah, actually, the WHO just came out in the beginning of June. You're correct with the 3 layers. And so it's be fabric material, and it's just from a mechanical standpoint, they think that 3 layer is best. It used to be cloth layer with even if you got like a paper towel, something thick like that to kind of make the difference. But they do recommend 3 layers now. I will tell you, I get a lot of kickback from parents and even just kids because it's hard for them to breathe through, the 3 layers. It just is hard. Now, when it comes to the N95 masks, we know that those are best. And remember why we're wearing the mask. We're not wearing the mask more so to protect us. We're wearing the mask to protect us if we have it, from protecting the people that we talk to. So, and I recently had a patient that came in with coronavirus, and I'm glad the mom had on a mask and I had on my mask, the N95 mask, and that's probably the reason why I didn't catch it.
Okay, so as we were told from the beginning, putting on just a regular bandana, that's no longer good enough because it doesn't have enough layers, correct?
Right, that's correct, but that's better than nothing.
It's better than nothing.
That's better than nothing.
And should we be wearing some kind of eye protection, as we know that you can get corona through your eyes? Should everybody have on some sort of glasses?
I know myself, when I'm in seeing patients, I wear my glasses as a layer of protection. Now, we all don't have to have face shields or whatever, but just think about when we talked about how you can catch it. So, yeah, glasses will help. I know a lot of the doctors here at the clinic with me, they're wearing their glasses also. They're not wearing.
Any entry into your bodies or into your mucous membrane. So that means your eyes, your nose, and your throat.
So will social distancing be a practice that we will have to consider the new norm? No longer the new norm, but the norm. So
social distancing should be the norm.
For the rest of our lives. I know they talked about we'll no longer be shaking hands. Like, they don't do that in other countries. I know China, they bow their head and they nod their heads and fold their hands. Are those things that we need to consider that will no longer be a part of society as we know it today?
Yeah, keep with the social distancing. Like Dr. J said, this is our normal. This is how we do things now. We have to groom or teach our children that this is how it's going to be, unless by some other intervention or miracle that we have something occur that gets the virus out of our ecosystem, or we miraculously build up these mutated antibodies against it.
Yeah, so basically the norm is to be socially distanced. I've had the opportunity down here in this red state versus I guess you all up there, but we've opened back up. I've actually even gone to the movies recently. But the movie theater, actually, everybody wore masks. You got your food, the rows every other row, and everybody couldn't sit in the same row. And it felt good to actually go to the movies. It was an old movie too. There's people like me that just needed to get out the house. I just need to get out the house. When we go to restaurants, some restaurants are packed, especially Cinco de Mayo. Packed, like, wall to wall, no mask, no nothing. And those are the restaurants I don't go to. Then you have other restaurants where everybody's wearing masks. They ask you specific questions before you go in, and you sit down and the tables are spaced out. And I will go to those restaurants that are practicing, it's kind of, I hate to say it like this, but practicing safe sex, right? It's like practicing safe ways as far as, with the coronavirus. Now, the thing is the more and more I think, practice social distancing, and more and more things we do, if we do the right thing, I think eventually we'll actually see Corona go away.
Perfect. And it's interesting that you say, about practicing safe sex, versus Corona now, because I compare that to me being single in the dating world. I said, no longer are you going to be asking people, hey, what's your are you sexually transmitted diseases? I'm going to be saying, what's your Corona status? Can you give me your letter showing me you have had the antibodies? How long you're going to be say? Everything is a new normal. Dating as we know it is new. It's how we do it is new. I have learned more about people over the phone now to be able to shut them down before ever even considering even going out the door anymore. Right. Because coronavirus has made me just think about things differently. Are you worth risking, as Dr. Karen would say? Are you worth the risk? No. And so it's been an easy way for me to answer the question. So, Royalty, what else do you think we need to ask the doctors?
So, Dr. Hargett, where is the medical community with the creation of the vaccine? Because both you and Dr. J have mentioned that the coronavirus is not going anywhere. It's here. So where do you think the medical community is with the creation of a vaccine?
I think as far as the medical community, we do know that it takes a long time for vaccines to be properly developed and tested. So it's it's more than ambitious to say that we will have one by the beginning of the year, because one thing is we don't really know exactly how coronavirus is affecting us. We're postulating that it's through different things. So through the ACE inhibitor, as I spoke about earlier, or other people have other methods. There are people across the world that have they're more advanced in their vaccine development, for their proposed vaccine development, because they are relating it to things that they worked on during the SARS-CoV-1, basically. But right now, I think there are two U.S. companies that are heading towards small human trials. However, it doesn't even matter where they are in the process, because any vaccine, let's say one comes out tomorrow, a vaccine is not going to cure coronavirus for people who have already contracted it. That's one. Secondly, we need the benefit of time to test the efficacy and to see what adverse effects that we have from vaccines. That's another reason why vaccines, rightly so, take so long to see if the benefit it outweighs the risk. So that's another risk benefit. But what the medical community is on that is that they're trying their hardest. Everyone's trying to rush to be first. But as far as the public is concerned, would I feel comfortable advising someone to take the vaccine in August? No. because I don't think too much is known. I don't think the part of the process of the phases that it goes through has been vetted, and we need time. There's nothing but time that can give us that information.
Yeah, so basically, just to kind of reiterate what she says, I think she's just trying to be politically correct, actually. But normally when you have a vaccine, it takes 5-6 years to get it through, 7 years. You have different phases. You have phase 1 all the way through phase 4. Phase 1 is at the beginning stage to see if it's effective in, animal studies and those things. Phase 2 looks at efficacy. Phase 3 looks at trying to do a more broad population. So it normally takes, a good 7 to 10 years, and that's why a lot of the pharmaceutical companies hold on to the patent for a long time, because of the fact of all that it took for them to even get it to the market in the first place. There's several different companies working on it. The last study I saw that it was like 125 companies at the very beginning stages worldwide. But the one thing that Dr. Karen was being political about was, is this something, I don't know if you all are familiar with, called warp speed? Are you all familiar with that coming from the White House?
Yep.
Yeah.
So warp speed is actually where we're going to just jump all those different stages. There's several companies that are on the cusp of being at the warp speed stage. So just imagine them being monopoly, where you don't stop, you just keep going around and you speed the process. When that occurs, then they will have it out on the market. They're looking at October as some of these companies at a warp speed, looking at maybe showing and actually producing a vaccine. But the question is, and I'm definitely for vaccines. I mean, I don't actually accept patients that don't vaccinate. But when it comes to a new vaccine that went through warp speed, that hasn't really truly been studied, I'm not going to recommend that for me, my family members, or my patients. Now, if they choose to take the vaccine, if they want to get the vaccine, I mean, we're going to have it available here. But, the likelihood of me recommending a vaccine that has gone through warp speed testing, like, we don't even know the long-term effects of coronavirus. Right. So if you're introducing a vaccine, because it might be a live vaccine we're introducing, because several companies have live vaccines, partial protein vaccines, different vaccines that they have for coronavirus. And I'm not going to introduce a live vaccine like MMR, which we know works. I'm not going to introduce a live coronavirus vaccine into a patient.
That's really interesting, because they've started actually giving vaccines out in Africa already. And so it's going to be really interesting for me to see what the outcome will be. And also the willingness of people to take the vaccine. I'm one as well that is very hesitant to say that you're going to skip through and go around the monopoly board on my life and decide that you're going to already win the game and put me as one of the people, the board players, just to be tested on. And I get it. People are going and volunteering for the testing, and I thank them for going forward and being first. I appreciate you. I'm not going to be one of the ones that goes.
I actually have a problem with them starting in Africa first, in China. Like, and that's a whole nother one of y'all sister talks.
Yeah.
Why are we starting in Africa? Why are we starting there? Why are we not starting somewhere else?
Right.
Always in the case of us being the guinea pigs that go first. But that's a whole nother story. And that's my own personal opinion. Let me state it on air. It has nothing to do with nobody else. It's all me individually.
Exactly.
And, I'm very concerned with, there are all kinds of conspiracy theories about this is a way that they want to eliminate the population. And because they put out there that we are the ones with the underlying conditions, they're going to push all of us to go first. Guess what? I will not be first. We're going to put some other authenticity, some diversity in this. Get some Caucasians to go first. Let them fly on the planes first. Let's see that everybody is able to sustain this vaccination. And then maybe we'll think about getting them in. But it is things that we have to think about. And then what happens when you take that stand of saying, I'm not going to take the vaccine? Like, for me and Royalty, we both telework. But when they decide to open back up the office, can we say, and the vaccine is out, that we've elected not to take the vaccine and want to continue to telework? Will you be able to make those options to be able to continue to take care of your family and make a decision for your health that is the best decision for you? But as I said to everyone, no one gets to make my medical decision for me. I take that into my own hands, whatever that is. So if that means that one job is lost, another job will be gained. I'm a firm believer in the man upstairs. He does not bring me this far in order for me to let somebody else make a decision about what's best for me and my children. And I have to be the caretaker of myself before I give that permission to someone else. Being in partnership with a doctor is what I do. I don't let them come in and tell me, here's what we're going to do. I always say, oh, this is what you're proposing? Okay, let's have a conversation about it. Let me do my research and I'll come back and we'll have a conversation about the next steps. But I don't let anyone dictate to me any decisions that I make in my life. So I'm going to continue to be walking that same spirit of the Lord is upstairs is the one who guides me. I pray and ask him for direction, and that's the only one that I take direction from. So Dr. Johnson, when do you think that a vaccine will be available? I know we're not talking about warp speed, but we're talking about if we had to look at the process of what it normally would take to get a good vaccine, to make sure that we had enough test groups, that we look at people with underlying conditions, and that it is safe for everyone to take it, and that it's a good product. How long do you think it would really take us?
Well, like I stated before, normally it takes 5 to 10 years to come up with a great vaccine. But like I said, the studies, the things that I've seen, say it looks like they're going to have some available in October, November. But you said, and I can't honestly say one vaccine is good. This is just my own personal opinion too. So I can't say that the vaccines they're going to have in October are bad. It's just that I'm just uneasy with giving those to my patients. What do you think, Dr. Karen?
Yeah, and remember that they're putting forth a hypothesis. Even though they've had tests on animals and on maybe a small population, but whether they can attribute all of that, like Kim was saying, to the general population of all over the world, we don't know. And we don't even know if this is going to, there are thousands, hundreds of thousands of vaccines trying to make it out there even before coronavirus. Like, this is the process. And a lot of times things come to a certain point and they fail. We find out that this is not going to work. They got to go back to the drawing board. So what happens with these two that have been able to jump the administrative portion of the phases and, just to get it out there, we just really don't know. And I think it's going to be years also. And primarily because we haven't even gotten over the first wave yet, before there to be a second wave. So for them to, and with the mutation of the virus, for them to be working on something, it might be like the flu, every year we have to, find out what characteristics of the flu types the previous year in order to apply it to the next year, presuming that we're going to encounter the same strands. But we don't know, is that going to happen with coronavirus? And if it mutates, are they going to have to keep up leveling up on the vaccine, if it's a vaccine that actually works? Ideal situation is a vaccine that's effective, it works, people are, we have control over it, but then when the following season or whatever comes with exposure, when the traveling resumes, will we get the same strand or will we get something else? Or will we have another novel coronavirus 2021?
Royalty and Zenfili, can I ask you a question? Have you all ever heard of the vaccine Rotatech? I mean Rotashield. I'm sorry, Rotashield.
I have not.
Yeah, so that, and I know Dr. Karen knows about it. So that was a vaccine against the rotavirus that came out in the late 90s. And they started, and this is a vaccine that had been proven and gone through the proper trials. It basically, when it started to give the vaccine, it was causing these patients to get intussusception and needed surgery. So they actually took it off the market. So, after about 6 months to a year, ended up having to take this vaccine that had not gone through warp speed, but gone through regular speed, and it ended up having to take it off the market completely. So that's just give you some food for thought of the fact that, we have vaccines that have gone through the proper trials and they still actually end up being taken off the market.
Interesting. Thank you so much for all of the information. My head is still spinning about all the things that I've learned today. I mean, I'm fortunate that I don't have young children, but I do have a niece and nephew that are 6 and 9. So my sister's going to be able to get a lot of valuable information about how she should proceed with letting the kids play or school next year and sports and everything that you need to consider as a parent, and making sure that you are being the best advocate for your child. Advocate as far as their medical attention is needed, things that you need to be careful of, and the symptoms and signs that you need to be aware of. It's nothing that I can say to thank you all enough for bringing this much needed information to our listening and viewing audience, knowing that not a lot of people are talking about it. And so these are things that they would not experience had it not been for this platform. So lastly, is there anything that you want to add or anything that you think that would be of value in closing out so that our listeners know about coronavirus or things just to be cognizant of as we close the show? Dr. Karen, we'll let you go first as a lady of our program.
Oh, okay, thank you very much. So I wanted to mention that I think the current snapshot of our North American society is that the cases that are rising now, they're happening more in a younger subset of patients, not necessarily the nursing homes, like 35 years, in between 35 and 50, I think it is. So we don't know where this is going. I say that to say that because we just had different holidays. We had spring break, we had, Mother's Day and Father's Day and different. So as we keep not social distancing or not taking those precautions, we are going to continue to be at risk. So I implore everyone to just keep that in mind, that just weigh your rights as a citizen to not be able to do something or to have to wear a mask against putting the greater society at risk, because we know that we're not saying that it's your fault, but we can't fight a virus. And this virus we need to take precautions so that everyone as a whole can be protected. And like I said, the vaccine will not cure you if you have the disease, if you've contracted the coronavirus disease.
I'll go next. So basically, the few things I want to say is that there's actually some theories on the waves that will actually occur. One of them is we'll have a big wave when flu season comes, and then we'll have a smaller wave in March. That's the first theory, and that theory is based on the flu pandemic that we had in the early 1900s. The second theory is we're going to have a bunch of little small waves that will persist for the next year or so, and it'll be regionally. The third theory is that because no one's actually on the same page, it's like everybody's playing pickup basketball, depending on what state you live in. And so that theory is that it's going to persist for the next 3 to 4 years. It just depends. So my recommendation would be to follow what the CDC's recommendations are. That's what we need to do. We need to get on there and follow their recommendations. Quit the politics, quit everything, and just follow the CDC's recommendations. I will also suggest all of you all, if you all are involved in some kind of organization, get on the CDC's website and learn how to do contact tracing. Contact tracing is going to be needed to follow in case you do have someone that tests positive, how we figure out who they've contacted. And then the last thing is that, we kind of mentioned briefly, but I am a minister, but we need to talk to the man upstairs and realize with his divine guidance, we need to listen to him and have faith. And just like, the people did where they painted the above their doors with the blood of the lamb and stayed inside and stayed protected, we kind of have to do the same thing and trust and have faith in him.
Absolutely. And to our wonderful parent, Dr. Wanda, we're going to let you close us out. Is there anything you'd like to say to the parents that are viewing and give them some advice on just what to look out for their children? And thanking you again for your story and your strength and your faith.
Just wanted to tell everybody, like the doctor said, just be careful. Be vigilant on where your kids are going. Be very vigilant. And just know that the virus is real. I mean, it's really real. And it baffles me, at times when I hear, people are taking their kids this place, that place. But I wanted to say something back as far as with the school thing. I'm not really sure what I'm going to do when school starts this year. I don't agree, like Dr. Karen said, that for it to start. They need school, but as far as being physically in the school, I just don't believe we're ready. And so I just don't know what I'm going to do when that time comes, if they was to say for them to come back to school half a day. I mean, that whole thing right there is just crazy. So, but just, the parents, listen to what the doctor said as far as, follow the CDC guidelines, follow your own guidelines as far as, keeping your kids safe, because although your kids, may not, they can be affected in other ways, such as my son. And you never want to go through that experience. It's the most scariest time that you will ever have. It's scary. That's
Thank
it.
you so much.
I'm going to be.
Thank you. All right. Well, this concludes another episode of Systematic Speaks. Once again, we come to educate, to relate, and to make sure that everyone walks away from our show having more knowledge than they had before. Thank you for joining. We'll catch you next time.